Hello, hello, everybody. Welcome on in to another installment of Medical Talk in Layman's Terms with Nurse Charlene. And I'm your host, Nurse Charlene. And I have a really deep topic today that I want to speak on, or this evening that I want to speak on. And it is called grief, loss, death, and dying. Yes, because we all got to do that sooner or later. And we got to experience that. And we pretty much experience it all our life and everything. But the important part about this is that somebody got to talk about it. So why not me? I'm willing to talk about it and everything. Let me see if I could get my little folks on and stuff and get them started and everything. And here we go. We'll be getting on in here. Okay. Yep. Okay, I got you on. Okay, so welcome back. Welcome me back and everything. But yes, so the topic is grief, loss, death, and dying. That's a very important thing because it seems like to me that nobody is talking about it and everything. Welcome on, Miss Sandra and T. She said, "Good evening, everybody." Nurse Charlene, Rosie, and Britt. All right, good evening, young lady and stuff. Thanks for coming on. And so this is a topic that's probably near and dear to more of us than not and everything. And that is death and dying. We all got to do. We all got a birth date when we come into the world. We also have a death date when it's our time is up. Our time is up and everything. And this is very important and I don't want to rush it. So I'm going to try my best to, it's a lot of information, but it's definitely something that we need to talk about because just recently, and this is not just the first of, many, but it has happened several times before. And that's with people passing away, some unexpected, some expected, and some, but all of them, nobody was ready for. That's what I have to look at. And recently, God bless her heart, I looked at a mother having to put, say goodbye to her son for now, bye for now, not gone and never to. I feel like you can meet up with them in the end when you go also and everything. But the scream that she let out is a mother scream. And definitely it was something that it just sent chills through my spine and I felt that hurt. Um, Not because I couldn't feel it with anybody else and stuff. It's just it's a wail. It's something that you have to be related to in some type of way, and it hurt. That alone. I think that might have the scream was worse than actually viewing the body and everything. So when I'm talking about this, I'm talking about something I experienced, and I'm talking about something like people are looking for what do we do when this happens, like how do we act and everything. And it's like what do you do? How does it happen? If somebody has that magic question to be answered, can answer that and stuff, let me know because I can't even tell you. But what I am going to do is I'm going to let you in on some information that I've read up on and studied on and stuff that will help you understand why you act like that. But it's never going to give me the answer of this is what you're supposed to feel. You're supposed to act like this because there's no one size fits all. And so it's never going to be something that something that you can just okay, if you go to this book and you read this chapter or something like that, this will help you. Yeah, it doesn't work like that, but you'll find out tonight. So I'm going to read my podcast disclaimer and then I'm coming on in. And I see, oh yes, oh okay, that was Sandra. Okay, so we getting on there now. So It's Welcome to Medical Talk in Layman's Terms with Nurse Charlene, where health and illnesses are broken down into simple, easy to understand conversations, even death. This podcast is for educational and informational purposes only. While Nurse Charlene is a licensed registered nurse with extensive healthcare experience, the information shared here is not intended to replace professional medical advice, diagnosis, or treatment. Every person is different. What works for one individual may not be right for another. Always consult your doctor, nurse practitioner, or qualified healthcare provider with any information or questions you may have regarding a medical condition or before making changes to your health, medications, or lifestyle. If you think you may have a medical emergency, get off of here, please, and call 911 or seek immediate medical attention. The ER is probably the best thing. The views shared on this podcast are based on professional experience and general medical knowledge, presented in layman's terms to help bridge the gap between healthcare and everyday understanding. By listening to this podcast, you acknowledge and agree that this is not a substitute for personalized medical care. It's not a substitute for the real deal, talking to your doctor. No provider-patient relationship is established, and you are responsible for your own healthcare decisions. Remember, your body speaks, your body's a snitch. Please believe it. Listen to it, respect it, and when in doubt, check it out with a medical professional. Thank you for tuning in and taking a step towards better understanding of your health. Okay. So that's my little spew on that and everything, my little disclaimer and everything. So tonight we are talking about grief, loss, death, and dying, and how people take it. Oh, they're so strong. They do this and they didn't even cry at the funeral and stuff. You don't know where they cried at, and you don't know if they're gonna break down after the funeral or whatever, happens and different things. And it's so much out there, just put yourself in that little area where you're looking at one of the good ones, I look at is you watching all these cop shows, CSI, FBI, and all of that stuff. Look at all these people that are dying. They belong to somebody, even if they're not, estranged with their family. Just look at it and look how we're inundated with all these cop shows, these shark movies, these, all this stuff. And look at that. And that's actually death and dying. If you were in there and you were on a boat and the sharks was, swimming around your airplane that crashed or whatever, and stuff, all this stuff, I'm just looking at all of it. And it's like, you're looking at the movie. Ooh, that movie was good. But yeah, that was a movie. So you feel like it's pretend. They had to get that from somewhere in order to write a whole movie, an hour-long movie, and do all these props and blowing up things and stuff like that. Something had to happen for them to get to this point where they're even giving you that much information. So that's what I'm talking about. Welcome in, Auntie Josie. Thank you for coming on and sharing your evening with us and stuff. So as we go along and stuff, feel free to chime in at any time. I'll try to make sure I keep up with the different comments and everything. If I don't see it and stuff, please forgive me. But Nurse Charlene has been a bad girl. She needs glasses and she hasn't got them yet. Good for me, yes. But I let you know that I needed glasses, huh? So my eyes was snitching on me. And so therefore I know that I need to put some glasses on and stuff so I can start reading this stuff right and everything. Or I'm gonna have to blow up the papers that I read, all my little studies and stuff, into 35 to 45 sheets of paper because I can't see. So as we go along and stuff, Auntie Josie said, good evening, everyone. Glad to be here tonight. Hope everyone is having a great evening. Yeah, so she hopes you all are having a great evening, and we hope you are having a great evening, Auntie Josie and stuff. So welcome on in. All right, so I'm going to be talking about something that then hit everybody over and over and over and everything. And I understand it, everything. And I know that you all had losses because guess what? I've had losses too. Yep, I didn't save everybody and I didn't do all of the, okay. I'm just saying that I'm in the nursing field, I'm in the healthcare field and everything, but I see it all the time in my job, and stuff. And then I see it all the time in my real life because my real life is just like me and you. We're the same, when it comes down to that. I cry just like you. I got feelings. I get my feelings hurt and everything else, just like everybody else. I have those good times. I laugh. I sing, and everything else like everybody else and stuff. So you're totally normal. And this is how I'm going to normalize how you act and everything. Wait till you see what I'm talking about. Okay. So my goal is to present to you what grief, loss, death, and dying really mean, why grief affects everyone differently, what happens emotionally, physically, mentally, socially, spiritually when someone dies. Oh, this is good and good. The difference between dying and death, the common stages and process associated with grief, why we are often never completely prepared for death. This is cold. Why talking about death is important and how to support someone who is grieving, when grief may require professional help, when you might need to get a counselor, and everything, and how to participate in open, respectful conversations about death and loss. Welcome on in, Auntie Rena. She said, hello, beautiful niece. Tell Mama Rosie and Brittany I said hello. I sure will. I think they're tuned in also and stuff, but thank you and welcome on in and thank you for coming on and everything. I'm talking about something a little more somber, so I don't really have a whole bunch of jokes and stuff about this one because this is some real deal stuff, and that is grief, loss, death, and dying. Okay. So those are some of the things I want to try to get through, at least some of them today. And okay, one is, what is grief? Okay. Grief is the emotional, mental, physical, and sometimes spiritual response we experience after a loss. Grief is not limited to losing someone to death. You can also grieve. Listen to this. You can grieve these things: a loved one, a parent, a child, a spouse, a friend, a pet, a job, a relationship, your independence. One minute you knew you live by yourself, you knew every part of your house and everything, and now they coming in because you forgot and left a pot of something on, they burned up, and now they think that you're demented and you losing your memory and stuff. So now they want to come in and take over. And it's and stuff. So that independence, your health, your ability to do something you once enjoyed, a pregnancy, a dream or future you expected to have. Okay, so that's also a part of grief. And in simple terms, because we got to break it down simple, grief is what happens inside of us when something or someone important to us is no longer the way it used to be. Meaning they left me, and now, what do I do with myself? This is happening and everything, and this is happening to all of us and stuff, and it's definitely something to fear, a little bit and everything, because that's the natural thing. So what is loss? Loss is the absence of someone, something, a relationship, ability to, or opportunity or circumstances that was meaningful to us. That's what a loss is. Examples: There's a physical loss, and it's a couple examples: death, amputation of something, or the loss of your mobility. Once you could walk, and now something happened, and now you can't walk, and you're in a wheelchair for the rest of your life, and you have to depend on that, and everything. Not to say this is not to down anybody and stuff. This is just saying this is a part of a loss. Then there's an emotional part of a loss. That was a physical. Emotional is a divorce. That's a loss. A breakup, uh, estrangement, or something like that of some sort. I don't know how that, but they put it down as an example. And then there's also a financial loss. So it's not just loss of a person or something like that and stuff. It's also a financial loss, and that would be a job loss, bankruptcy, all the stuff you used to have, and now you couldn't handle it, so you had to file bankruptcy, or loss of a home. You were a homeowner and stuff, and now you're not, and everything. That does something to you. Okay. And then you can have health related losses, and that would be a diagnosis of a serious illness that you might not, you might have to take it to the end, and then it may take you out of here, and stuff. But it's what's happening and everything. Then it's also the loss of your independence. Like, I was driving and everything. I know I'm 105 and stuff, but I could still see. I know where the stop signs are. Yeah, but you just sideswipe 15 cars. It's probably time for you to stop at 105 from driving. But I'm just saying that that's a loss and everything. Moving, social one is moving away. This is all you knew was California. This is what you know, and now it's not, and everything. So that's a loss, a social loss. And then also losing a friendship. You guys were rocking for a while and stuff, and then something happened. It doesn't matter what and stuff, and that friendship is no longer there and everything. So that's a social loss. And then also isolation. And now because something happened or something like that. Welcome on in, Miss Brittany on the line, y'all. And stuff, something happened and stuff. Now you don't want to go outside. You get this stuff, I think it's called agoraphobia or something like that, where it's fear of the outside, being around people socially and stuff. But that can happen to somebody depending on what kind of loss they've taken, what kind of trauma happened to them and everything. So the important thing is you don't have to attend a funeral to experience grief. Just knowing that it happened to the person, whether you go to the funeral or not, it's still whatever that person was to you, it's going to still be that person that it was to you and everything. Yes, Rena said, "Hey, Britt," and stuff. So then, what is death? Death is the permanent ending of the body's ability to function as a living organism. We are all human beings and living organisms so far. And when death comes upon us, we are no longer a living organism. We are now, faced with that. So this is what I'm talking about. That's why I said it's a kind of tricky subject and stuff, but I'm just letting you know that that's the scientific way of putting it. When a person dies, the body can no longer maintain the functions necessary to sustain life. These include functions involving the brain, the heart. The brain stops, sending fire messages. The heart stops beating. The lungs, they stop pulling in air to you because you're no longer here. You're not sustaining life. Your circulation, it stops, it ceases because your heart is not beating, so it's not getting that circulation around. So if you can understand me on this, your metabolism is gone, and other vital body systems, they're all done because you're no longer sustaining life and everything. So just trying to keep this as respectful as possible. In layman's terms, death means the body has permanently stopped functioning as a living body. Death is a biological event, but for people left behind, it becomes an emotional event, a family event, a social event, and sometimes a spiritual event, like having a funeral inside of a church, and and the eulogies and all of that stuff. Just remember how that goes. It's a social event because once that person is gone, then all the people come around and they want to, attend the funeral or whatever. They get their obituaries, they sit down, they have a service. It might not be in a church, but a funeral home is still the same thing. They play the music, somebody sings, somebody talks about them, and so on and so forth. This is not for everybody and stuff. It's other types of ways that this can happen and everything. Sometimes there's a casket, sometimes there's an urn. It depends on the disposition of whatever is being done and everything. But the whole point is that's what it becomes when somebody has died. Okay. So what is dying? Well, I found out that dying is not the same thing as death. And I found out a long time ago, of course, and stuff, but to put it in terms that we're talking about it right now on August 25th, 2026. Okay. And that is, dying is the process of approaching death, of coming up to death and everything. Death is the event. Dying is the journey towards the event, which is death. And that should make sense. I know that makes sense and everything. Some people die suddenly. Others may experience a gradual decline over days, weeks, months, and years. Okay. A person with advanced illnesses may gradually experience increased weakness, sleeping more, decreased appetite. They stop eating, but that's not something that would sustain their life, even if they did eat a whole bowl of food for you and stuff. That's not it. Everybody, oh, they eating and stuff. That doesn't mean that they're living, because your body has this strange way of protecting itself. And so if they know the person is going to choke, the body knows to stop it, before you start trying to scoop in a whole bunch of cream of wheat or whatever, you trying to fix up for the person and everything, and it will not sustain life. So even food will not sustain life and everything. So just letting you know that your changes in breathing as it's coming along, it's the journey to death and everything. So that's what dying is. And changes in alertness, they might just sleep all the time, unarousable at all, and everything. And you start looking like, yeah, you kind of get the feeling. It's still stressful, it's still painful. These changes can be frightening for the family. Yes, they are. They're absolutely frightening. And understanding what may happen can make the process less frightening. So that's why I'm talking about it tonight. Welcome on in. Okay, death does not always look the same. There's no single way that people die. Someone may die suddenly. Examples is a heart attack, a stroke, some type of trauma of some sort, or cardiac arrest. That means that sudden cardiac means is referring to your heart, that your heart stops. No heart, no aliveness, and everything. So that's what suddenly is. Gradually is advanced cancer, end stage organ disease, like being on dialysis and stuff. Your kidneys have broken down, they don't work anymore, so a machine has to do it for you, but eventually that wears out, and stuff. So it's some work to be done. And advanced neurological illnesses and stuff, that those are things that happen and everything. So yes, and those are the gradual ways. What else did I want to say about that? Okay, and expectedly, a person may have been living with a terminal illness, and the family understands that death is approaching. Unexpected is a person may appear relatively well and die suddenly. But she looked good. She didn't look like she was sick or anything like that. Yeah, you don't know what sick look like, or if it don't look like, a lot of people know how to hide it, and everything. So it doesn't necessarily look like that. I've even found myself doing that. Like my patient, she was doing good. She gone, or whoever it is and stuff like that. So I've even found myself doing that, knowing that I know the diagnosis, that I know the process and everything. So all of this stuff is really, it's something to think about, because we've all been touched by it. It's not a person that looks at this right now or can tell me that this has not happened to you in some type of way. You might still be here physically looking at me, and I'm looking at you, looking online or whatever, social media, but this has happened to you. And it's something that you just gotta just know that this is a part of the process also. Living, and the loved one leaves you, but you're still here. So what do you do with that space that they took up in your life, that love in your heart? You got to just go on, but there's not a trick, a way, a side, a medicine that I can give you or give me to stop me from feeling the way I do when I lose somebody, or if you lose somebody and stuff. There's not a medicine that any doctor can prescribe to you, because guess what? The doctors die, the surgeons die, the nurses, the surgical techs, whatever it may be and stuff, they all go somewhere, and stuff. So this is serious. This is very serious. Okay. So what is grief supposed to feel like? Okay, what is supposed to feel like if I'm grieving somebody? How am I supposed to act? Do I just be quiet and then I read the Bible, right? And yes, that might help you, but we don't know what your grief is going to look like. Your body will act up and snitch and tell you what you're going to need to do, whether it's fall out, whether it's, get mad and angry and tear something up, drink, smoke weed, pop pills. I want to be numb. I want to be numb. It's a lot of ways of numbing things and stuff, but they don't fix it, and they don't turn back the clock of time so that person appears to be alive again and stuff. Nothing you can do. And so you can damage yourself so that you can go with them, and stuff like that. But that's about the only thing I could think of. And that's from trying to numb yourself, and then you take too many pills, and next thing you know, something is happening with you. So, okay. What is it supposed to feel like? A grieving person may experience some emotional symptoms like sadness, anger, guilt, fear, loneliness, confusion, shock, sometimes even relief, regret, numbness. I'm just numb. Yes, relief can sometimes be a part of grief. Okay. For example, someone may feel relief that a loved one's suffering has ended and simultaneously feel tremendous sadness because they're gone. But they're no longer suffering. But that's not enough for you. It's never going to be enough and everything. Welcome on in, Miss Rosie Granny. Alan, she says she's watching in Jesus' name, and the topic is very heavy. My. That's right. And you see, I never disappoint with my board behind me. I write this up according to whatever I'm talking on and everything. And it's like a cartoonish type thing and stuff, but it's saying some of the things that you see. They got the pour out a little liquor and RIP and never forgotten, and your tombstones and different things like that. Over here is the candle, a rosary, or my version of it, of course. But that's where all of that stuff comes from. So this is definitely a heavy topic. Thank you, Mom. Thank you. And everything. So grief can affect your brain. Grief is just a feeling, emotion. And it affects your brain by things like, I can't even think straight right now. Where's my keys, and stuff. Forgetfulness, difficulty concentrating, trouble making decisions. I don't know. Was we supposed to do this or what? You don't remember nothing, and everything. It's confusion. It's mental exhaustion. I gotta go lay down. I can't function, and all of this stuff. All of those things, they're actually normal. Give yourself some grace if you experienced any of those and everything. Being preoccupied with the person that passed. Yeah, you lost them just for now. I don't want to go into any other and stuff, but you lost them. Yes, that's a big deal. It's painful. It, are they hurting? Do they still feel anything? Like you got these questions. I know it sounds weird, but it's totally normal. Okay. So in simple terms, your brain is trying to process a major emotional event. You may temporarily have difficulty focusing on ordinary things, like you can't even tie your shoestrings, stuff, because it's so heavy on you, it's so painful and everything. And grief can affect your body. So first it can affect your mind, and that's what that was. And so now it can affect your body and stuff. Sorry, you guys. And that will be your fatigue, your headaches, your muscle tension, just tight in the neck, stiff neck. You change your appetite. You might not be able to eat at all, or you might overeat. Either way and stuff, it's painful. You have weight fluctuations. You have sleeping problems. You can't sleep because you're just thinking about that person. It's taking over your whole body and stuff. And it's because it's love involved. A lot of the times, your stomach is upset. You got increased anxiety and rapid heartbeat and feeling physically heavy or exhausted. Like, I just can't, I don't know what to do with myself. It's really that bad, because remember, the mind and body are connected. So it affects your mind, and your mind grieves. Then it affects your body, and your body grieves. And that's what the loss of appetite or overeating, whatever, feeling exhausted, then your brain confused and forgetful, and you can't make decisions, things that you would just do in a snap. You can't do anything. You just want to be kind of left alone. You don't know what to do. And it takes some time. And you still may not even, even after the loss and stuff, you still gonna be thinking about it and everything. But guess what? Don't get on your back. It's already enough that it happened and stuff, because it's normal for this stuff to happen and everything. So then there's this thing called the 5 stages of grief. And I'm just going to read them off real quick. Denial, anger, bargaining, depression, and acceptance. Okay. So what does that mean? Denial. You've been denied, credit or something like that and stuff. So denial. What it may sound like is, this can't be happening to me. Like, what happened? What I thought we the doctors must be wrong. I need a second or a third opinion. I don't care and stuff, because I know I pray a lot and stuff. So can't nothing be touching our family like that and every. Okay. I just saw them yesterday and stuff. They was fine. And okay. I'm just saying. What else? That's denial, anger. That would sound like possibly like, why did this happen? Like, I thought we was good. Okay. What else? It's not fair. Why her? Why him? Why? Okay. So I'm acting this out. I hope I'm doing pretty good at that and stuff. I'm acting it out to let you know what these feelings look like, when you're dealing with the stages of death. So we're under anger and stuff. It's not fair. Why don't someone else catch it? Why didn't someone catch it sooner or something like that? Why it had to be her? She ain't did nothing. She been living a good life and stuff. She ain't did nothing bad to nobody, and this is happening. Okay. And you said, mind, Granny Rosie said, mind, body, and soul. Yes, sir. That's right. And stuff. It affects everything about you, to lose somebody and everything. And anger coming from the person that's, might be processing, transitioning and stuff. Why me? Before they go, and everything. That's hard. And then you got the anger may be directed towards the doctors. If that doctor, see, I hate that doctor and stuff. He don't be doing nothing, and then now he gonna tell me I got this, or you see what I'm saying? Yeah, it's so easy. Or towards family. Y'all ain't did nothing for so and so or such and such. No wonder they died, or you see what I'm saying? Or God, why God let this happen? I always pray and stuff. God gonna let this happen. Exactly. Is it their fault? No, they're just taking you through the process that they know best. God knows the ultimate, so he's not even in that league and stuff. But what I'm trying to say is they'll turn it against something else. See, that's why I didn't take that COVID and stuff, because they're gonna kill us anyway. They're gonna give us COVID and we're gonna die anyway, or something like that. Who is they? Why they get to be so important? Okay, but you can blame them if you want to. I'm just saying, I don't know if that's all the way true. Or maybe it might be you. You went somewhere where there was COVID being passed around and you was at that concert jamming and it went right up in your mouth and stuff. And now you mad at the doctor because he told you got COVID? Be mad at Mary J. Blige, or be mad at the Whispers or whatever and stuff, because you was at their concert and somebody in the audience had. Okay, I'm just saying. Being mad at the healthcare system. If they wouldn't try to cut all our insurance and stuff, we'll have better stuff, and then these doctors won't be just out to kill us and everything. Mad at the person that died. Why they just die like that on us? That ain't your decision. But I'm just saying, it does happen that way. It literally happens that way. Or mad at yourself. I could have did more. If I was here more, I would have been able to. Yeah. You don't know their expiration date. They don't know yours. You could have went before them, and then what they get to say, and stuff. So I'm saying all of this to say this is the most human thing that we got going for us right now is death and dying, that process up to death and everything. And that is anger doesn't necessarily mean someone is a bad person. Sometimes anger is pain wearing a different outfit. That's cold and stuff. So it's anger is pain wearing a different outfit. It's coming addressed as this concern, but it's wearing a different suit, so you didn't catch it. You got your bargaining, because I said it's 5 stages bargaining. So I'm not going to go through a whole bunch of it and stuff. I'm saying is when you bargaining is, if we had gone to the doctor sooner, maybe this wouldn't have happened. Or maybe it wasn't meant for you to go to the doctor sooner and stuff. But yeah, maybe it wouldn't have happened if you went to the doctor. It is a possibility. If only I had called more and checked on that person. Maybe it was a situation where they were unchecked on and stuff, and you couldn't and everything, but you think that you could have stopped their death. You don't know what happened. You don't know what was already going on far before you even thought of that, or not calling them, and stuff, before you even thought of not calling them and stuff. If only I did something differently. Oh my God. Okay. Yeah, you can't control it just because you do a little extra and put an extra Band-Aid or something like that. That would be like me trying to do something extra, and I can't stop what's going to happen and stuff. I can't stop when it's going to happen to me. So let alone anything else and everything. So just because you're privy to a little bit more medical stuff doesn't mean that you will clean up well. that you'll escape all of this stuff, because you get it just like everybody else. You get a headache, you get an earache, you get things happen to you, you catch things and all of that stuff just like anybody else. Okay. Then there's depression. The depression part is the reality of loss may become overwhelming. And so depression is crying, withdrawal from everybody, backing up, from everybody, loss of motivation. I just can't even get myself out of the bed. That loneliness, depending on who passed and everything, that loneliness, exhaustion. I'm overwhelmed with just thinking about it. I can't stop thinking about it and everything. And you probably won't for a while until you do. And then difficulty functioning. All of these things are really, something. But last but not least, is acceptance. Acceptance does not mean I don't care anymore. I'm praying for your strength. I'm praying for, you and the family strength. Y'all just got to get strong and stuff, and you'll be able to move on and everything. You don't know that, because what if it happened to you? So you gotta play both sides of the fence. You got to use that empathy. It's called the ability to put yourself in someone else's shoes. Would I say that to me? If I experience this loss, like what is that part looking like and everything? So acceptance. I recognize that this has happened, and I am learning how to live with it in this new reality. That's one way of accepting it. A person can accept the death and still deeply miss someone. I understand that they're gone, but it hurts. It's like a hole in my heart. I don't think what can I fill that up with? Is there anything? All I would say is, tap into your higher power. That's the only thing I could think of. There's no medicine. There's no cryotherapy. It's a loss. That's a loss. That's a loss. Okay. And then acceptance, but not forgetting. Meaning, I love you, rest in peace, but you're never forgotten. Respecting that person, respecting all that they were while they were here, good or bad, all that they were while they were here, because they got a piece of your heart. That's why you're taking it so bad, because one person, you might go to this funeral and you paying your respects, but you're not sad. You're not going home sad. But then it's this other funeral and you sitting in the front seat with the family, because you are the family of that person and stuff. And that one hits, and everything and stuff. So just remember, give yourself some credit. You are a human being. You are a person. You are a loved one, and everything and stuff. So take care of you and stuff. Give yourself some grace. And grief is not always just one straight line. It's going to be this. Yeah, because that would be kind of like pretending like you know what to do if somebody lost somebody. And so nobody would ever trip off of losing somebody, right? Yeah. So let me see. It's okay to feel I'm doing okay today. Meaning I woke up, I did a little bit more. I brushed my teeth and combed my hair, and I made dinner. Okay. And then there's sometimes a birthday can trigger the grief, like their birthday or something, that happened the day that they passed away and stuff. You might never forget that date and stuff. And so you start relating that date with the day they died and kind of reliving it over and over again and stuff. That does happen. Sometimes it's a song can trigger grief. A certain smell. If they always made peach cobbler and then you walk by a bakery and you smell the peaches and stuff, that happened, that, and stuff. And it reminds you of that person. It's so many different things. A holiday, They loved Christmas. They loved Easter, and stuff like that. And now, for Easter, you're thinking about them. So Easter turns into a grief day for you. Christmas turns into a grief day for you and stuff. And it can and stuff, but it's actually normal. Your body doesn't know what to do with itself. That's why it's no medicine for it. It's no hypnotism or something like that to fix this. Yes, Auntie Rena said, "Amen." That's right. A photograph can trigger grief. Walking into an empty room can trigger grief. This is normal. Grief has waves. Some days the waves are small, and some days they are huge, overwhelming. Like their birthday, and you're like, "Wow, my mother's not here. My father's not here. My husband's not here. My wife is not here," or something like that, and everything. And a reason why we're never really ready for death. This is one of the biggest questions. Even when someone has been sick for a long time, family members may say, "I knew this was coming, but I wasn't ready." Why? Because knowing and accepting are two different things. Your brain may understand, my loved one is dying, but your heart may still say, "Please don't leave me." Okay. And it's normal. Why we aren't ready. We don't want to imagine life without them. That's one of the biggest reasons why you're not ready, because it just seems like the world is colder without that person in it. And you're right, it does feel colder. It does feel more painful. The person may be a part of your daily routine, your identity, your husband, your wife, or something like that, your pastor, or something like that. Of the person may be a part of your family structure, a part of all your memories of them, them being in it, and everything. Certain traditions, they are part of it, and everything. We may associate them with the future and think, "Mom will be here for my next birthday," or "Dad will meet my children," and then they go before that time. What else did I want to say? We all celebrate Christmas together. They gotta stay for that. No, they don't. It's when the process is done, it's done. It's nothing you can do about it. They don't have machines to bring them back, because once they're gone and God ceases it, it's done. It's nothing you can do about it and everything. So I just wanted to make sure I got that in there and stuff. And that was the stages of death and dying, and kind of like some examples. Why is it so important to talk about death? Okay, this is really important. It's because what we refuse to discuss can become much harder to manage when it actually happens. Talking about death doesn't cause death. Talking about death can help us prepare for it and everything. I used to hear this all the time and stuff. "Oh, they gonna get a GoFundMe for this person," and stuff like that, and they getting a GoFundMe. They didn't even have an insurance policy on them and stuff. And now they gone, and they can't even pay for the funeral. They asking everybody for money, hundreds of dollars and stuff, and all of that stuff. And that's so mean. They lost somebody. That person is gone forever. So they already been cut up, chopped and screwed, and stuff like that. And then you want to talk about them because they trying to ask for a few dollars and stuff. Some people are just not prepared and everything. But that's something that I want to get over to you guys and understand. Welcome on in, Michelle. She said, "Hi, Charlene. How are you?" I'm doing fine. I'm talking on something that all of us need to hear about. And it's because I recently went to a funeral, and more recently than that and stuff, it's been several people that are close to me that had losses in their families, and it just hit really hard. So I figured, since I talked about stress last week and stuff, that I would talk about this and everything. So that's what I'm doing and everything. But welcome on in, my dear. and stuff. So why is it important? Another conversation about death that can help families is to discuss the wishes of the person. Where would someone prefer to receive their care? Who should make healthcare decisions if they cannot make them anymore? What matters most to them, and everything. And then discussing the advanced care planning and stuff. People can communicate what their healthcare wishes are before they become unable to speak for themselves and say, I don't be doing no CPR on me and cracking my ribs and everything, or something like that. I want to just go naturally if that's what I need to do and stuff. But those are things that need to be said, because it's a lot of people out there that they just want to go on, and then you keep on getting them clear, boom, and stuff like that. Yeah, what if they don't want to be cleared no more? They just let me go. Or don't cremate me, that makes me feel like I'm burning in hell and stuff. You bury me, or don't bury me and stuff, because it ain't me in there. It's just a box with my bones and stuff. I'm already gone, and stuff. You don't need to be worried about this or that and stuff. You don't know what they're gonna say and everything. But yes, those type of things. You need to discuss these practical manners with everybody, but it shouldn't be just for that person and make them feel, oh, hi, Nina. She said, hi again. Yes, welcome on in to Medical Talk in Layman's Terms with Nurse Charlene, and that's me and stuff. But welcome on in, my dear. I'm talking about a pretty touchy subject, but I'm gonna go over a little bit and stuff, and because I need to get this out to you and stuff, because we are experiencing death and dying all the time in our lives and everything, and it's so much stuff that we need to discuss and things like that. And one is like funeral preferences, like I said, cremation or burial, what color suit or dress this person is gonna wear, who's going to do it, and everything. Do you have the insurance and the will to be able to do that? Another thing that gets caught up in the pain of somebody dying is who going to get granny ring, or who going to get so-and-so and such, or, and stuff like that. And you like, oh, they came through and they just took all her crystal, and all of that. And you more concentrated on the crystal. That person passed away, and stuff like that. So what happens? The people that are still left here, they already hurt and fighting each other, trying to kill each other and take each other out so everybody can go with them and stuff. But do you got your funeral stuff? Do you got your funeral clothes? Do you got your stuff in order? Well, I'm still young. I don't need to be having no funeral stuff all together and stuff. Why should I have all that together and stuff? And I'm young, and yeah, ain't nothing gonna happen to me. The devil is a lie and stuff. But yes. Nina said, I pick up my brother cemetery today. He's passed away August 10th, 2026. Oh my God. I'm sorry, my dear, and definitely condolences go out to you from everybody, the crew on the line now and everything and stuff. Definitely, just praying for your strength and everything. And when I say praying for your strength to go on, not to forget, not to get over it or anything like that, but because it hurts. And that's what I do know. And I have never heard a person that I've come across ever say it didn't hurt, including me and everything and stuff. But God bless you, baby. And then what else? I said you gotta take care of your funerals. Your documents need to be in order. Your preference and what funeral home possibly, and stuff. If you've been here a while and stuff, that's what grandma and great grandma and grandpa and all of them, they had their plots already paid for and stuff like that. We might not all do that and stuff, but definitely doing something, have some type of preparation, because that's even more stressful than the person passing, because they passed and you don't have the money to fund whatever needs to happen to them and stuff like that. It's hard. I didn't say, I'm not putting anybody down. I'm saying this is what happens to you. So then the mind goes away from hurting for the person, and stuff, and dealing with that grief and everything, and it goes to the physical part of trying to get it together and everything. Oh, you picked up the cremation today. See, that's what I'm talking about for your brother that died on the 10th of this month and stuff. See, that I know that was hard, because it's almost like reliving it, and then you're there with your urn and everything and stuff like that, and then you're looking at it, and it's no longer your brother. It's the ashes of his body in there and everything and stuff, but it's not no longer your brother in there, but it's a symbol, and everything, and that symbol of respect and stuff. But definitely, I'm gonna keep you in my prayers and stuff, because I do pray. It's to each his own, whatever your higher power is. I have nothing against that and everything, but my higher power tells me pray for him no matter what, and that's what I will be doing and stuff. But thank you. And another thing that we got to deal with is, what is end of life care looking like? And that would be end of life care is focuses on the comfort and quality of the life of the person who is approaching death. That means you're on your journey. You started your journey to death. Death is the actual event. There's no more of you. Dying is making it up to that point. Yes, no problem. Thank you, Nima, and stuff. So, what is it? Depending on the situation, care may include pain management. Oh, they gave him too much pain. Nope, 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 nope. Not too much pain medicine just takes them out and stuff. It's a lot of processes before they just go and everything. And pain management, you will want, would you want to be hurting and then go to death, and stuff? So then you can't make that mistake of thinking if they give this too much, then they're going to die quicker or something like that and everything, because it's when they go and everything. So the problem is, sometimes we have to have that empathy, even for a loved one and stuff, and them getting ready to go and stuff. You're not in their body, so you don't know what they feel. But put yourself in their shoes. You want to suffer and then go ahead and die, and stuff, because that's what they could possibly be doing. Then also there's managing their symptoms, managing the snitch. It's certain things, sometimes they can make gurgle sounds because it's too much fluids, in the back of their throat. And that's what makes that little funny sound, a little raspy sound and stuff. And it sounds uncomfortable to you, but it might be just fine for them. But they got stuff to dry up, secretions, they call it, saliva or spit and everything. Spiritual support, getting the pastor there to pray with them, and you saying prayers with them if that was something that was really important and stuff, doing that. I remember being a hospice nurse for a company, and the nurse called me, and I was a visiting nurse, and so I could get to the nursing home, and nobody was there, and the family was on the way, but nobody was there. And the nurse that was in charge, she just wanted me to stay in the room until the person passed away, because it was imminent that they was going. And I was not sure of how that was going to make me feel, because I didn't know the person. So no, I'm not going to fall all over the floor crying or something like that. But at the same time, that's a pretty special thing when they wait till you get in there and you're by yourself with them, and then they pass away on you, and everything. And you got to figure out how, that would make you feel and stuff. You got to, what am I, because it made me question, why am I here? Like, I don't know if I'm supposed to be doing this, and that's because of my emotions and unhealed wounds from my family's passing, and everything. So it's that type of stuff. And then you got your different things like palliative care, hospice, nursing home care and all of that. And we're all faced with those things, and they're hard. Like a palliative care, it focuses on improving the quality of life while you're still alive and everything, like managing your symptoms and stuff like that, keeping you from suffering, and stuff because you're still awake and stuff. So that arm that's hurt or that leg that's hurt or something like that, or, it's hard to breathe, they give you the oxygen, they give you this, they give you whatever it is and stuff, and treat those things until you pass, if you pass, and everything. Then you got hospice. A lot of people think of that as a weird thing and stuff like that, but hospice is not necessarily all they did. That they said hospice, they gonna die. No, it doesn't mean that, but I'm gonna tell you what it means. Hospice generally focuses on comfort and quality of life when a person is approaching the end of their life. And treatment is no longer aimed at curing them, the underlying terminal illness and stuff. So they know you're gonna pass. It's a high probability, but we're still gonna just treat you good. We're gonna, let you knit until you knit your last blanket, or whatever it is and stuff. But whatever it is, they want to give you a good quality until you just go to sleep and, you pass away. And this can include some medicines to, allow that to happen. The simple difference between palliative care is the comfort and quality of life during the serious illness. And hospice is the comfort focused care when someone is nearing the end of their life, when they're near, coming up on death, their journey to death and everything. And so the things that you want to do, how can we help someone that is dying? How can we help them? Or what do we say? And sometimes the most powerful thing you can do is simply be there. When they open their eyes, they see you. When they close their eyes, they know you there. You hold their hand. Maybe they might not be able to open their eyes anymore. You hold their hand because hearing is the last thing to go and everything. So then you don't need perfect words to say, but you can say, I'm here. I love you. Wow. You are not alone. You are not alone. No worries. How can I support you? What can I do to make you feel better? Right now, okay, let's go and everything. Would you like me to sit with you? Tell me what you need, and if they're able to, that's beautiful. Hello, Sonia. Sonia, welcome on in. Hello, sisters. She said, how are you doing today? I am doing fine, my dear, and stuff. And I'm talking about a really important thing, and that is grief and loss and death and dying. And I know that that's something that has visited your life pretty recently and everything. And God bless you. And I'm so glad that you are trying to hold on and keep a strong heart, and stuff. I miss you too and everything, Sonia. Oh, and stuff. You know what? You could call me after the live and stuff. I want to talk to you. Thank you guys, because it's certain, people when they come on and stuff, sometimes the social media doesn't have to be the end of us, and stuff. Sometimes, we need this so that we stay in touch with our, loved ones and our friends and good sisterhoods and stuff like that. And definitely, it was good to hear from Sonia. And don't force someone to talk about it. Like what's happening? Tell me what you feeling. Do it hurt? And stuff. You don't tell somebody that's dying that, and stuff. Do it hurt and all of that? Oh yes. Sonia said to Mama Rosie, she said, tell mommy, she said hi. And my niece, Brittany, hello. I said hello. That's so sweet and stuff. I will definitely get that message to them. I think they're both on watching and everything. Oh no. Let me see. Nima, you said now my other brothers passed away 2/13/2022. The doctor told me that so I can wait. So I when thought, oh, you thought it is was your other brother. And here the last thing, I was sitting and watching them for 4 days, but I left, got a call 2 days later. Wow. Oh my God, Nima, I need to really talk to you and stuff. Um, when we're talking about this is how serious this is, you guys on here. Anybody that's still on and listening and everything and stuff. When these things happen, these are real people coming on. They're speaking their truth. This is a non-judgmental platform, and I welcome the discussion. I welcome the testimonies. I welcome all the things that that are involved in this, because we got to start standing up for ourselves. That's why so many people mental health gets destroyed, not just messed up a little bit because they're missing their family member, but it gets destroyed because of things like this. And it hurts and everything. It will hurt me. It has hurt me in the past and everything and stuff. And this is serious. We gotta take it serious. We gotta not be afraid to take to talk about it. We gotta be not afraid to make them decisions and stuff. Just because you plan a funeral, or you pick out the dress, or you pick out the tuxedo, or suit and everything and all of that stuff, doesn't mean that you're wishing death on that person. You might go before them and their stuff is all picked out and yours is not, and everything. So it's not that, it's that this is serious, and that it needs to be paid attention to and everything and stuff. So with that being said and stuff, Nima, I got to figure out how I'm going to talk to you and stuff about that. So I'll reach out to you and message you and everything. But this is definitely serious. I thought that I read it wrong, and that's only because I did announce that I don't have glasses, so I can't see everything, but definitely it's painful. Yes, that would be a wonderful thing to write a book, because you can't make these things up. The losses and back-to-back losses and everything. This is hard, and everything. So Nima said, I'm thinking about writing a book about my life. You can absolutely do that. And you could have probably wrote the book on just you alone. But there's a reason that sometimes people are chosen to be able to put things in place for people and everything and stuff, because you might be that soldier that God needs to to work with, and everything, so that the disposition of everything gets done right, and everything. Somebody might not be as strong as you, other family members even, and everything, but you were strong enough, and it didn't make you less hurt behind the loss. It just means that, yes, this is a lot for you, and definitely something to deal with and everything. So definitely I, like I said, my heart with you and stuff. So then when we talk about that and stuff, I told you about the death and dying. So I'm gonna go ahead and kind of skip along to the ending of it and everything. Yeah, I had some about children and grief with children and everything, and yeah, it'll get too deep. I might have to just part two this and do the rest of it next week. That's what I think I'll do and stuff, because this is something that we gotta get to. And I discussed this with some other people that give me ideas on what to work with. And one of the main things we were talking about is we got to start touching mental health. As all these weird things are happening to us out here in the world and stuff, the politics and all this crazy stuff and stuff we haven't seen in years, ever seen this type of stuff, happening. And we got to get to that part, and everything. So I'm gonna go ahead to my take home message and conclusion, and then I'm gonna let y'all go so you can get you something else to eat before 9 o'clock p.m. and stuff. And we'll get it on down and stuff. So it's just gonna take me a couple minutes to do this. And on a take home message, there's remember these 10 things. 1, grief is normal. Being sad, being hurt, feeling the loss is absolutely normal. So that's number 1. Number 2, there is no single correct way to grieve. Yeah, you don't get a book and you're supposed to grieve like this and you're supposed to lay down on your bed and say this 10 times. No, there's no correct way to grieve. It's however your body takes it, the way your body snitches, the way your body activates this or activates that or whatever and stuff. There's no special way for this to happen. And then we got number 3. Grief is not a straight line. Okay, it's not just and then you're done like a task and everything. 4 is knowing death is coming does not mean you will feel emotionally prepared. Even if you know that it's coming, nothing will prepare you for when that person takes their last breath. It's just almost impossible. I've never seen it done and everything. And then I will read the comments in just a second. And then number 5, death affects the entire family, not just the person who dies. The entire family. So you might be like, but I'm so sad. Yes, but somebody else is sad too, because they love the same person you love, and everything. They loved you the same way, and stuff. So when this is happening, it's not just about this person or that person and what their sadness is. Everybody hurts. Everybody has a different way of hurting about it. And everybody was a different person in that person's life that left us and everything. And not left us in a mean way, but left us because they had to go and everything. Death affects the entire family, not just the person who dies. Talking about death does not make it happen just because you said something about it. That's a lie. Conversation before death can prevent confusion later. You can love someone and still experience anger, guilt, sadness, or even relief after their death. You don't have to grieve alone. You never have to grieve alone. And you can ask for asking somebody for help is not a weakness. It's a superpower. And that's part of it and everything. And then I'll read the conclusion, but I've seen a couple. Let me see this one. I seen something else. Let me see if I can bring it back. Okay. Nima said, before then, I had another brother pass away 12/3/2020. To that, why I said, because I have a lot of brothers. Oh my God. Oh, wow. My mom and dad, I have 7 brothers, no sisters, and I am 62 now. So God shows me a lot. That's why I want to write the book. You absolutely have to. We got to claim that and manifest that and stuff. You have 7 brothers, and it looks like I want to say 1, 2, 3, at least 4 have passed away. I don't know if it's more. And then you said your mom and dad has also passed and everything. That's a lot. That's a lot of death. And you see how real this is. Like, I'm not on here playing a game or something like that and stuff. This is realness at its best, and everything. When people are talking about this stuff, you don't know what somebody is walking around with. If they talking to themselves or something like that, you can't automatically, oh, she crazy, oh, he crazy. It's like, this will make you crazy, like literally make you feel like you're crazy. You know, crazy is not a real diagnosis, but you know what I'm saying and stuff. It's hard and everything. Welcome on, Auntie Barbara. You said I'm late. I know, that's all right. You come back on when I get off and watch the replay and everything and stuff, and then we can discuss some stuff together also. And then Auntie Josie had a one. You said, when my dad was in hospice, I was by his side for 4 months, and I was going to go to Las Vegas for Thanksgiving with the family, and the nurse said, can I talk to you? She talked to me about my father and told me he had 2 days left, so I didn't go with the family, and I was seeing him until the 2 days, and he was gone in 2 days. Oh my God. And I was glad I didn't leave, but it still hurts me so much, and had to go get help. You absolutely did. I know you did, and everything and stuff. And so with that one, Auntie Josie said that when she, when it was her father was in a process of passing, that she was with him at the bedside, with the hospice and stuff, and just stayed there with him. And he probably enjoyed every single bit of that. That's the good part about that, because that's what they need you to do. They don't want you to be like, oh, or start crying over him before it's happening, and stuff. Like, cry over when I leave, and stuff. Don't cry over me now. And I'm like, am I supposed to leave now? You start crying now. So, and stuff like that. You save the crying, to yourself and everything. But when you're in that room, you need to be positive. You need to just be loving. You need to watch Family Feud with them, do things like that. Listen to some church music that they might like, or something like that and stuff. But you need to be attentive to that person. Don't already check out before they check out. And then for the people that die suddenly, unexpectedly, they were looking good, and all of a sudden they're gone now and stuff like that. With those and stuff, don't just kid yourself. Oh, they too young to die. They ain't gonna die like that. And stuff. Yes, everybody that comes in here is faced with the fact that their book has to end, their story has to end. And everything. And it was a good thing that that nurse must have seen a certain set of symptoms on Pops, that might have indicated that, yeah, it's not too much longer. Maybe the respirations kind of slow all the way down, because they still sometimes take the vital signs, or take the heart, the pulse rate and stuff like that, and they could tell by that and the medicine and stuff, and them getting more sleepy, more unaware of what the surroundings and everything. But just remember this, they can still hear you. So if y'all all fighting in a room, they just gonna sky up out, and stuff like that. But also just remember that this is a art to this, and stuff. I was told by a chaplain at a hospital and stuff that it made me feel like, wow, and stuff. But she said they play a movie of their life, and they go back to when they was first born and coming out the womb and stuff like that. And then as life, progressed, and they had kids, married, have kids, or unmarried and have kids, however the story goes, and then they go through all of that. And when they get to the end, they look around, see who's there. And if you're not there, okay, and stuff. But then it's over, and everything. And I really believe that's pretty close to the truth. And, they've seen that and everything. Oh, yes. And Nina said, let me see. I was going to name my book 7 Boys and 1 Girl. In and out of stress. Yeah, because that's tough to be that warrior. It's almost like you're the warrior woman, and everything, because you're the only girl, and it's seven boys, and and then each of them, just like you being the only girl, each of us have to go and everything, but you're here because there's something on your life that's keeping you here to take care of things until it's done, said and done and everything. But don't think at 62 that you old and it's the end and stuff, because the 62 is not old. I'm sorry, but just remember that you still got a lot of life to live and everything and stuff. But I could never tell you how to grieve or anything. I could tell you that this is normal, and whatever you feeling and the hurt you feeling or the hole that you feel that it just can't seem to be filled up, because another one and then another one and another one, and dealing with those waves and dealing with all of that stuff. It's no way for me to tell you that you're supposed to do it like this. Yeah, it's never going to be that way and stuff. You just gotta just keep on until and everything. Oh, she said, thank you again. You made me feel better. You such a sweetie and stuff. But I don't want to make you feel better about death. I want you to feel better about the fact that you're here for a reason and you have a calling on your life, and you gotta just hang in there. You gotta take the bumps and the bruises, because they're coming, and they have already been here and everything, just like I do. I got to take the bumps with the bruises. I didn't say it hurt. I can't even tell you how to cry, when to cry. Do you cry at the church? No, it's not no way of doing that. It's not just this. It's, you got to give yourself some credit and everything, that yes, I'm here, and you might have been born just for that and everything. So with that being said and stuff, just God bless you, definitely. And we need to talk, because you're gonna go ahead and manifest this book. You got to and stuff. It's so to have 7 brothers and then you're the one daughter and everything. Wow. Oh yes. Oh, okay. You took a picture of the picture board in the back. Yes. Bless your heart and everything. I know Auntie Barb, she sent a heart and stuff, but that's what's going on. That's definitely what's going on and stuff. I'm gonna go ahead and y'all can keep the comments coming as long as I'm online, but I just want to do the part of the conclusion. I'm gonna go ahead and part 2 this, because it needs to be said. There's so much that I didn't say tonight, so I'm gonna just make a part 2, and that is death is one of the few subjects that connects every human being. We may have different cultures, different religions, different backgrounds, different beliefs, different experiences, but eventually every family member will encounter loss. The question isn't whether we will experience grief. The question is, how will we learn to face it? Okay, you guys, this is real talk. We have to stop treating conversations about death as something that should only happen when someone is lying in a hospital bed. Talk about it before the crisis happens. Talk about their wishes. Talk about the love for that person. Talk about forgiveness. Talk about your fears. Talk about what matters. Tell people what they mean to you while they still can hear it. Tell them what they mean to you while they still can hear it and stuff. It means a lot. It'll bring you through a better place if you're able to do that. Then they just died, and I didn't even get a chance to say. I'm just saying, because sometimes the words we wish we had said after someone dies are the very words we were too afraid to say while they were living. This is cold. Death may take away someone's physical presence, but it cannot take away the impact they made on your life. Let me read that one more time. Death may take away someone's physical presence, but it cannot take away the impact they made on your life. Grief is the price we sometimes pay for having love someone deeply. And remember, your body's a snitch, believe it. If your heart is hurting, your mind is overwhelmed, your body is exhausted, or you simply don't know how to cope, listen to your body. Acknowledge your grief. Talk about it. Reach out to someone. Don't be afraid to ask for help. It's not a sign of weakness, it's a sign of power. Medical Talk in layman's terms with Nurse Charlene, taking the scary world of healthcare and breaking it down one issue at a time in terms everybody can understand. Okay? That's what I want to do. Break it down to something you can understand, because you may be able to partially heal. You'll never heal from the grief you feel of that loss, but you can probably heal other things, and you'll be able to get up and live another day. Get up and eventually start that work. Get up and eventually be present in the people that are still here, their life and everything. So this is very important. And that's why I will be going with the number 2, because I didn't even talk about children and the loss of children and what that even looks like and how painful that looks, on to people and everything, the stillbirths and miscarriages and, different things like that and stuff. These are all things that, we have to be faced with. And so the next time you see somebody and you want to label them crazy, have you looked into their life and see what they seen? Mary J got that song, When You Look at My Life and See What I've Seen and everything. Have you looked at my life and see what I've been through? Then you can't tell me how I should act, how I should grieve. And I can't tell you that. Even as a nurse, guess what? We don't have the answers, because I told you, nurses die, doctors die, surgeons die, everything. So when you're thinking about that or who to blame and everything and stuff, remember, they're not your family member. They might say, oh, that person passed, but they can't cry for every single person. They wouldn't even be normal. They couldn't even handle it and everything. But they can continue to tell you what you don't want to hear sometimes, and stuff, telling you about that diagnosis of this. I hate going to the doctor because they just gonna give me a shot and tell me this. They trying to give me that COVID vaccine, and I already seen that the government talking about it make you change your DNA and your mRNA and all of this stuff, and everything. I get it. We're so inundated with a lot of stuff. Get on with somebody that got some good, honest experience behind it, pain behind it, and everything else. And look into that person, pour into that person, not somebody that's gonna be messy and just tell you something. But how did you get that information? So you're with the government, you with the military, or you with whatever people is trying to purge us and kill us all off, and stuff. Like, look at where they're coming from. How long have they been doing it, and stuff? Even me, I only been doing it a few years, for about 4 years now and everything, podcasting and stuff. But I've gotten so much deeper because I study so much more. Everything is not by chance. Everything that I study on here, everything that I talk about on here, you can fact check it. Not only that, but this stuff is coming from the heart. It's coming from experience. It's something I'm going through, something I went through, something I saw somebody else that I love go through, and stuff like that. So that's why I'm talking on it and speaking on it and everything and stuff. And so you need to get you a good set of those type of people, with that kind of stuff behind them to talk to you. Because anybody can say anything, but they might be for the pharmaceutical company. They might be for this. They might be for that, and stuff. You don't know what it is, especially when they get on there and they try to tell you and stuff. Oh, okay. Nina said, thank you for your study. Thank you and everything for listening and taking the time out, and then maybe even applying some of the things, because I don't give you the holy grail to how to grieve. Nobody can give you the holy grail to how to grieve. Not your pastor, not anybody, not a human being, another human being, or an AI. But we can give you things that you can think about and stuff, like getting prepared, having a conversation so that it doesn't hurt so bad, calling that person that you afraid to call because you don't want to sound weird. Call them and be weird, and say, hey, I love you, I love you, I'm sorry, I need you, or something like that. Go ahead and do it, because if you don't do it, you're going to be left with that regret, and then you got to live with that until it's time for you to meet your death date, and everything. So at the end of the day, I thank you all and stuff, my loved ones and everybody that tried to hang in there with me. It's okay, because you can watch the replay and you'll hear all this stuff I'm talking about now and everything. But I appreciate you, and I appreciate you guys listening. I don't do anything by chance or just because the sky is blue and stuff. I do this stuff because it needs to be said. I watched a couple things and stuff. It needs to be said and everything. Thank you for all the participation, all the hellos, all the everything, all the testimonials and stuff. I appreciate you guys. And let's keep this organic. Let's keep this going and stuff. You are protected in here. If I see anybody doing some foolish stuff and making foolish comments and stuff, they're blocked. They're blocked and everything. And they will never get a chance again. And I'll make sure, because I know about the different platforms and the people that go search them out and find their IP addresses and everything. So yes, I'm not here to play and everything. Y'all take care and have a good evening. And remember, it's always something that you need to learn, because even if it's not for yourself personally, you can probably help somebody else and save a life by accident. She said, good night, my friend. And Auntie Nima said that. And Auntie Barbara said, thank you. Great subject. Absolutely. I'm going to go ahead and part two it, you guys and stuff. But y'all take care and just know that definitely God got you. Whether you believe or not, he got you. All right. Take care. And good night, Nina. All right. Good night, Auntie.